Cerebral aneurysm is a neurological disease. Look at this picture, shows that cerebral aneurysm CT findings. Look at this. Angiogram, visualize blood vessels. And MRI findings. Look at this. Detail going on. Introduction. A cerebral aneurysm, also known as an intracranial aneurysm, is a localized dilatation or ballooning of a blood vessel in the brain. It occurs due to weakness in the vessel wall and can lead to severe complications if it ruptures. Cerebral aneurysms are a critical medical condition that necessitate prompt diagnosis and treatment. Etymology. The term cerebral aneurysm derived from the Greek word aneurysma, meaning a widening or dilatation, and cerebrum, the Latin term from the brain, reflecting the conditions characteristic localized bulging of brain blood vessels. Definition. A cerebral aneurysm is defined as a focal outpouching of cerebral artery caused by a weakening of the arterial wall, which can lead to rupture and result in a subarachnoidal hemorrhage. These aneurysms are most commonly found at arterial bifurcations within the circle of Willis. Types. Cerebral aneurysm can be classified into several types based on their shape, size, location. 1. Saccular berry aneurysm. The most common type characterized by sac-like shape. 2. Fusiform aneurysm. A spindle-shaped dilatation that involves the entire circumference of the vessel. 3. Diseasing aneurysm caused by a tear in the inner layer of the blood vessels wall, leading to blood flow between layers. 4. Mycotic aneurysm resulting from an infection that weakens the vessel wall. 5. Traumatic aneurysm due to injury to the blood vessels. Causes. The exact cause of cerebral aneurysm is not clear, but contributing factors include 1. Congenital factors. Weakness in the blood vessels wall present from birth. 2. Hypertension. Chronic high blood pressure can stress vessel walls. 3. Atherosclerosis, plaque buildup can weaken arterial walls. 4. Head injury, trauma to the brain may lead to aneurysm formation. 5. Infections, conditions like bacterial endocarditis. 6. Genetic disorders, polycystic kidney disease, Ehlers-Danlos syndrome, and Marfan syndrome. Risk factors. Factors increasing the risk of cerebral aneurysm include 1. Age, most common in individuals aged 40 to 60 years. 2. Sex, women are at a higher risk than men. 3. Family history, genetic predisposition. 4. Smoking damages blood vessel walls. 5. Alcohol abuse associated with hypertension and vessel damage. 6. Drug use, especially cocaine or amphetamines. Complications. A ruptured cerebral aneurysm can lead to life-threatening conditions such as 1. Subarachnoid hemorrhage, bleeding to the space surrounding the brain. 2. Stroke, ischemic or hemorrhagic. 3. Hydrocephalus, accumulation of cerebrospinal fluid. 4. Vasospasm, narrowing of blood vessels causing ischemia. 5. Seizures resulting from brain irritation. Pathophysiology. The pathophysiology involves structural defects in the blood vessel wall over time. Hemodynamic stress and risk factors such as hypertension weaken the vessel walls, forming an aneurysm. If the aneurysm rupture, blood escape into the subarachnoid space, leading to increased intracranial pressure, brain tissue damage, and inflammatory responses. Here is a step-by-step overview of the pathophysiology of cerebral aneurysm. 1. Initiation and formation of aneurysm. 2. Aneurysm growth. 3. Structural changes in the vessel wall. 4. Increased risk of rupture. 5. Rupture and hemorrhage. 6. Complications post-rupture. 7. Healing and repair. 8. Long-term effects. Even after rupture and repair, there may be long-term neurological defects depending on the location and extent of hemorrhage. Patients may experience complications like cognitive impairment, memory problems, motor defects, and seizures. The pathophysiological process shows how a cerebral aneurysm develops and how its rupture can lead to life-threatening complications. Early detection and management are crucial to reduce the risk of rupture and improve patient outcomes. Signs and symptoms. Unruptured cerebral aneurysm may be asymptomatic. However, symptoms can include 1. Headache, severe localized pain, 2. Visual disturbances, blurred or double vision, 3. Neck pain, often due to irritation of nearby tissues, 4. Seizures, rare but possible, signs of ruptured aneurysm include 1. Sudden severe headache, often described as the worst headache of my life. 2. Nausea and vomiting due to increased intracranial pressure. 3. Loss of consciousness, variable duration. 4. Neurological defects, weakness, speech defects, or paralysis. A diagnosis. A diagnosis of cerebral aneurysm involves 1. Computed tomography (CT) detects bleeding in the brain. 2. Magnetic resonance imaging (MRI) provide detailed images of brain structure. 3. Cerebral angiography visualize blood vessels and aneurysms. 4. Lumbar puncture detects blood in cerebrospinal fluid if SAH is suspected. Nursing diagnosis. Ineffective cerebral tissue perfusion related to potential or actual rupture of an aneurysm. 1. Acute pain associated with headache or post-surgical recovery. 2. Risk for injury due to altered neurological status. 3. Anxiety related to diagnosis and treatment uncertainty. Management. Medical management. 1. Observation for small asymptomatic aneurysm. 2. Blood pressure control using antihypertensives. 3. Endovascular cooling, minimally invasive procedure to block blood flow to the aneurysm. 4. Surgical clipping, open surgery to close off the aneurysm. 5. Management of complications, vasospasm treated with calcium channel blockers like nimodipine. Nursing management. 1. Monitoring neurological status, regular assessment for changes. To pain management, administrating prescribed analgesics. 3. Maintaining a calm environment, reducing stress and blood pressure. 4. Patient education, discussing signs of rupture and the importance of follow-up. Treatment options. 1. Conservative management for stable unruptured aneurysms. 2. Endovascular techniques, coiling and flow diverting stents. 3. Open surgery, clipping or bypass procedures. 4. Rehabilitations, physical and occupational therapy for recovery. Psychosocial medicine 1. Counseling to address anxiety and fear. 2. Family support, education and involvement in care plans. 3. Support groups, connecting with others who have similar experiences. Prevention. 1. Lifestyle modification, avoid smoking, manage hypertension and maintain a healthy diet. 2. Regular checkups for individuals with risk factors or family history. 3. Avoidance of stimulants such as cocaine or excessive alcohol. In conclusion, cerebral aneurysm are a serious medical condition with potentially fatal consequences. Early detection and appropriate management can significantly improve outcomes. A multidisciplinary approach involves medical, surgical, and psychosocial interventions is crucial to ensure optimal patient care and recovery. Thank you. Have a nice day.